Calcium is an essential mineral for our bodies, playing a crucial role in building and maintaining strong bones, as well as supporting nerve function, muscle contraction, and blood clotting. However, too much calcium can be dangerous and lead to several health risks and consequences. In this video, we'll explore the dangers of too much calcium in detail, including its effects on the heart, kidneys, digestive system, bone health, and cancer risk. We'll also discuss ways to prevent excessive calcium intake and promote overall health and well-being. Hypercalcemia is a condition in which there is too much calcium in the blood, which can lead to several health problems. Common causes of hypercalcemia include hyperparathyroidism, certain cancers, and excessive calcium intake. Symptoms of hypercalcemia include fatigue, nausea, vomiting, constipation, confusion, and muscle weakness. Severe cases of hypercalcemia can lead to kidney damage, dehydration, and even coma. One of the most significant risks of hypercalcemia is the increased risk of kidney stones, as excess calcium can combine with other substances in the urine to form stones. Hypercalcemia can also lead to kidney damage, as the excess calcium can deposit in the kidneys and cause damage over time. While calcium is essential for our heart health, too much calcium can increase the risk of heart disease and heart attacks. Excess calcium can build up in the arteries, causing them to harden and narrow, leading to atherosclerosis and an increased risk of heart attack and stroke. A study published in JAMA Internal Medicine found that men who took calcium supplements had a higher risk of heart disease and death from heart disease than those who did not take supplements. The study suggests that excessive calcium intake from supplements may contribute to the development of heart disease. Calcium intake should be balanced with magnesium intake, as magnesium is required for proper calcium absorption and utilization. A balanced intake of both nutrients can help maintain a healthy cardiovascular system. Too much calcium can also lead to digestive problems, such as constipation, abdominal pain, and bloating. Calcium supplements can interfere with the absorption of other nutrients, such as iron and zinc, leading to deficiencies and other health problems. Calcium supplements can also contribute to the development of gastrointestinal problems, such as inflammation of the stomach lining, gastritis, and peptic ulcers. Long-term use of calcium supplements has been associated with an increased risk of these conditions. To maintain adequate calcium levels in the body, it's important to consume calcium-rich foods as part of a balanced diet. Good sources of calcium include dairy products, leafy greens, and nuts. However, it's essential to spread your calcium intake throughout the day, as large doses of calcium can interfere with the absorption of other essential nutrients, such as iron and zinc. Consuming smaller amounts of calcium throughout the day can help ensure optimal absorption and utilization of this vital mineral. While calcium is essential for bone health, too much calcium can lead to a decrease in bone density and increase the risk of fractures. Excessive calcium intake can interfere with the absorption of other bone-healthy nutrients, such as magnesium and vitamin D, leading to an imbalance in bone metabolism and increased risk of fractures. A study published in JAMA found that women who took high doses of calcium supplements had an increased risk of hip fractures compared to those who did not take supplements. The study suggests that excessive calcium intake from supplements may weaken bones and increase the risk of fractures. Calcium intake should be balanced with other bone-healthy nutrients, such as magnesium, vitamin D, and vitamin K. These nutrients work together to maintain strong bones and prevent fractures. Some studies have linked high calcium intake with an increased risk of prostate cancer, although the evidence is not yet conclusive. Excess calcium can also contribute to the development of other cancers, such as breast and ovarian cancer. A study published in the American Journal of Epidemiology found that women who consumed high amounts of calcium had an increased risk of ovarian cancer compared to those who consumed lower amounts of calcium. The study suggests that excessive calcium intake may contribute to the development of ovarian cancer. It's essential to consume calcium from natural food sources, rather than relying solely on supplements. Plant-based sources of calcium, such as kale, collard greens, and tofu, can provide adequate calcium intake without the risk of excessive calcium intake. To prevent excessive calcium intake, it's essential to monitor your calcium intake through diet and supplements. The recommended daily intake of calcium is 1,000 to 1,200 mg for most adults, depending on age and gender. Calcium-rich foods include dairy products, leafy green vegetables, nuts, seeds, and fish. It's essential to choose calcium sources that are low in fat and calories and avoid high-fat dairy products and processed foods. If you're taking calcium supplements, it's essential to talk to a healthcare professional about the appropriate dosage and potential side effects. High doses of calcium supplements can lead to hypercalcemia and increase the risk of health problems. In addition to monitoring your calcium intake, it's important to maintain a healthy lifestyle, including regular exercise, a balanced diet, and adequate nutrient intake. Regular exercise and weight-bearing activities can help maintain bone density and prevent fractures, while a balanced diet with adequate magnesium and vitamin D intake can support bone health. It's also important to avoid smoking and excessive alcohol consumption, as they can interfere with calcium absorption and decrease bone density. Managing chronic conditions such as hyperthyroidism, celiac disease, and rheumatoid arthritis can also help prevent bone loss and fractures. Finally, regular health screenings and checkups can help detect and treat any health problems related to excessive calcium intake, such as hypercalcemia, kidney stones, and heart disease. This concludes our comprehensive guide to the dangers of too much calcium. While calcium is an important nutrient for our bodies, excessive intake can lead to various health risks and consequences, such as hypercalcemia, heart disease, digestive problems, decreased bone density, and an increased risk of cancer. To prevent excessive calcium intake, it's important to monitor your calcium intake through a balanced diet and supplements, as well as maintaining a healthy lifestyle. Regular exercise, adequate nutrient intake, avoiding smoking and excessive alcohol consumption, and managing chronic conditions can also help prevent health problems related to excessive calcium intake. If you have concerns about your calcium intake or experience any symptoms of hypercalcemia, it's essential to consult a healthcare professional. By understanding the risks and consequences of too much calcium and taking steps to prevent excessive intake, you can promote overall health and well-being and maintain strong bones and a healthy cardiovascular system. If you enjoyed this video and found it informative, please consider hitting the thumbs up button and subscribing to our channel. Your support is greatly appreciated and it helps us create more high-quality content like this. Don't forget to turn on notifications so you never miss a new video from us. Thank you for watching, and we look forward to bringing you more valuable content in the future.